I think we need to anchor FGCs on different levels. On a casework level, as a home game, but we shouldn't just concentrate on resolving family problems with FGC. FGC has something to do with community building, has a much wider view on that. But FGC is also, FGC alone with the organizations, with the service organizations we have at the moment is not good enough. The service organization has to become much more flexible and much more innovative in the appropriate way for the lifelong than they are. And to anchor FGC, if not possible in the law, at least in civil society, like your Dutch system actually does that quite radically, I think is the right way to do that, to prevent that FGC becomes another smart therapeutic methods to convince the people that professional solutions are in the end better than their own solutions.
Well, a real pleasure to share with you today some findings of our research. As Rob already indicated, we have indeed just finalized our report. The only thing left to do is actually to apply for an international standard book number. But you are actually the first audience that will hear about the results of our survey. Here actually the costs accumulate to an amount of €412,000 spent over a 4-year period. If you go to the far left, you can see the number of months that this file has been running. I guess referral for family group conference is not a or between the family and the professional, but rather a and issue. It is, maybe one could say, about shared responsibility between families and professionals. And notwithstanding the uncertainties that we can safely end with a maxim from Nobel Prize laureate Tinbergen, who once said, "It is sharing that creates value."
Letting go, we have to encourage young people. See, no social worker ever comes to work to do harm. None of us come to work to do harm. So it can be really hurtful for social workers to hear that we want to change the way they practice. So we've got to guide them and lead them to actually, we need you. We need your strengths, we need professional people, but there are some changes that need to happen for your professional help to be more effective. First, knowledge ownership. We have to encourage our workers to move from knowledge owners to knowledge sharers. Social workers can be hugely helpful to families by helping them interpret what the literature, what the research is telling us about what happens to children in certain situations. Can your workers, for example, explain why it is necessary for children to have good nutrition, to have reasonably clean living environments, to have good nurturing from a parent, to not live in a critical environment? This is information that needs to be able to be conveyed to families in family-friendly language, so that we don't hold that knowledge to ourselves. We share it, and the families with that knowledge are much stronger in terms of decision-making. We often see ourselves as teachers. I don't know why I've got the right to teach there, but we often see ourselves as teachers, and the shift that professionals have to make is from teaching to learning. By definition, every situation is unique, so when workers go in, they have to listen, they have to learn. They can't go in as teachers. We have to move from being expert leaders to accountable partners. We're working in partnerships with families, and there's a mutuality in that relationship. They are accountable to us, we are accountable to them. So mutuality is extremely important. We need to move from being problem identifiers to solution finders, and that's a hard shift to make. From procedural prescription to communication. Essentially, work that workers do is face-to-face with clients. It's not following the dictates of a rule book.